As the number of COVID-19 infections worldwide top the 10 million mark, many developed countries appear to be taking one step forward and several steps back as they are forced to reinforce containment measures, days after easing them. As the Kenyan government prepares to further ease restrictions in the country on movement, the question is, will it suffer the same fate? Olive Barros has more.
Sophie's choice, effectively a choice between two evils. And it's between this rock and hard place that President Uhuru Kenyatta finds himself with regard to the COVID-19 pandemic. Open up the economy and risk losing thousands of lives to the virus and overwhelming Kenya's already tenuous healthcare system, or keep Kenya closed and continue to render thousands jobless and hopeless.
The question is, should we sacrifice a few people to suffer from COVID-19 and reopen the economy, or should we close the economy? People suffer economically, but we save lives. It is not a yes or no answer. It's a very difficult question.
Containment measures have indeed saved lives. However, they have too led to economic contraction, loss of jobs.
Economies far more developed than Kenya's are reeling from the shock and have gone on to ease restrictions on movement. And this is a path that Kenya is preparing to take.
We are going to be starting domestic flights, and this is what we're going to use as our trial over the, let's say, next couple of days, because we are opening up the lockdown that we have had between inter-county lockdown.
Problem is, as President Kenyatta himself acknowledges, this will inevitably see a rise in infections as those who've lost their jobs in the metropolis travel up country at the first opportunity to counties admittedly ill-prepared to manage an influx of infections. And even with home-based care marketed as an alternative, many now living below the poverty line barely have a room to share.
Nobody knows the right time to open. It's a matter of common sense, and weighing the benefits and the dangers. Cannot be not sure. It's not like mathematics there, 1 + 1 is always 2. This is a little different, and it's trial and error.
What government hopes to do is mitigate the impact of reopening the economy, or risk ending up back at square one. The economy even worse off should cases soar and far outstrip available resources. On top of the requirement that counties meet a minimum bed capacity of 300, they will be required to 1. Scale down rapid response teams to the sub-county level, 2. Enhance capacity to detect and manage cases, 3. Effectively communicate risks to residents, 4. Adopt a triage system at county borders.
There's also a triage system, simply asking you whether you have cough or difficulty in breathing. We'll be able to pick about 80% of the COVID cases.
5. Supply masks to elderly and those with pre-existing conditions as the governments work towards expanding lab testing from the current 28 centers in 12 counties.
Opening up too quickly also has its downside, as we have seen in different parts of the world.
A balancing act on a tight rope. One miscalculated step and Kenya risks jumping out of the frying pan into the fire. Olive Barros, NTV.